Hello, everyone. So I think we will start now, and people can also connect in the meantime. So first of all, I would like to inform you that this webinar is being recorded, and we will share the recording with all of you and also on the social media of SERIGO. So I invite you all to use the chat. My colleague Sophie will be writing there. So you can start by telling us your role or where are you logging from today. So welcome everyone to the SERIGO webinar, in which we will talk about the concept of intersectionality and how women's health in rural Europe is a good example to understanding this concept. I'm Marisol Castro, I'm communication expert at EIDO, the European Association for Innovation in Local Development, and I will be moderating today's event. So the webinar is part of SERIGO project. Most of you already know, but if we have any new person here in the event, SERIGO is a EU-funded project in which we are focusing on researching and testing social innovations, in particular those implemented by the social economy actors that improve the inclusion of vulnerable groups in rural areas. This is the fourth webinar of a series of events that we have been hosting as part of the community of practice, as part of the COP, that is dedicated to advancing social innovation for the inclusion of vulnerable groups. And it's open to everyone, just so you are free all to join, as well as our events. So this event in particular is focused, or each event in general is focused in a key thematic area that has been identified within the SERIGO research activity, providing a platform to exchange knowledge. And all the knowledge, all the takeaways from these webinars, we create some materials such as articles or recordings that we will share after the event. And also with all the knowledge, we will create policy recommendations at the end of the project to improve the inclusion of vulnerable groups in rural areas. That is our key area. So this event, now I would like to share with you the agenda. So as you can see, we have two sessions. So in the first one, we will speak about intersectionality and demonstrate the practical application within the SERIGO project. For that, we have three researchers. We have EURAC research, that is one part of SERIGO project. And also we will have the example of another project that is Inspire Equality. And then the second half of the event will be dedicated to explore more concrete examples of projects related to access to women's health, such as reproductive and sexual health services and also mental health. And for that, we have some examples from Spain and also from Czech Republic. So I think this is all. So now I would like to start with the first panel. So we have a lot of time to exchange. And also I invite you to use the chat if you have questions, comments, and also if you want to let us know about your project or how you are implementing intersectionality or your knowledge, you are all, of course, welcome to do it. So I will stop sharing the screen and introduce the first panelists. So as I said, we have three researchers. We have Marcia Bona and Alexandra Tomaselli from EURAC Research. And we also have Monica Grau Sarabia from Universitat Oberta de Catalunya, and also a part of the Inspire Equality EU-funded project. So first, we will start with Marcia. Marcia is a social scientist at EURAC Research, and her work focuses on migration, local development, and rural social economy in rural and mountainous contexts, with particular attention to migration governance, access to housing, and employment. She applies intersectionality and decolonial approaches to the study of inequality, and today she's going to be the one introducing a very general and overview the concept of intersectionality, what does it mean for rural areas and women, and also our approach within the SERIGO project. So I think she's not going to use presentation, so I will just give you the floor and you can start. Thank you.
Thank you, Marisol, and good morning, everyone. Thank you for the opportunity to intervene in this webinar. Let me start with a simple observation for the sake of introducing intersectionality in a very plain manner. So people don't experience challenges one at a time. A person is never just a woman or just a young person or just a person living in a rural area. So if you imagine a young migrant woman living in a remote village, her experience is shaped at the same time by gender, by her age, by migration background, legal status, and by the very fact of being living at the moment in a rural location. All these factors don't act separately, they overlap, and the overlap is what we call intersectionality, and what we did our best to integrate into the methodology adopted in SERIGO case studies for studying the role, the potential, and the limits of social economy in rural areas. So what do we mean by intersectionality in very simple terms? It is the idea that different aspects of a person's identity, such as gender, age, origin, disability, income, where they live, interact with each other and shape their opportunities and challenges. And the very important fact that it is not just adding factors together, it is about how they combine and create unique experiences. The term is grounded in Black feminist scholarship and activist, was coined at the academic level in 1989 by Black legal scholar Kimberly Crenshaw, exactly to show how the fact of being a Black woman added up different layers of discrimination, creating unique experiences at the time of entering the labor market in that specific case. Intersectionality is today widely used in policy, research, and practice. And I would like to point out why does it matter for practitioners besides the research application that we developed within SERIGO. So exactly for the reasons that I just mentioned. So the fact that intersectionality gives rise to unique experiences of discrimination, exclusion, and inequality. If we design policies, services, or projects for the average user without considering all the different dimensions that shape their experience, we would miss the people who are the most excluded. So intersectionality helps both researchers and practitioners to ask better questions like who is not benefiting from a given service, who is missing from the room, from the debate, from the discussion that brings to life a specific policy, and why is it so? So in short, intersectionality helps us, both researchers and practitioners, to see complexity, but more importantly, it helps us design better and fairer solutions. An interesting point, both for who is doing research and for who is acting upon services, designing them or implementing them, is the transformative call that is inherent to intersectionality. So also when applying it at the moment of designing a research process, as we did in SERIGO, it is never just about taking only a more accurate picture of the social reality. It always also encompasses a call to action. So it enables a better and more complex understanding, but the basic call is to also then use this more accurate knowledge to bring about change and try to compensate for existing inequalities and unequal access to resources. So moving to intersectionality in rural areas, that's the jump we tried to implement in our SERIGO methodology. What does it mean specifically to apply intersectionality in rural areas? We all know that rural contexts already come with structural challenges. It may be distance from urban centers, it may be limited service provision, fewer jobs opportunity, and often digital gaps. When these elements are combined with other factors such as gender, age, disability, or migration status, the barriers they bring about can become much stronger or simply more difficult to overcome. So to give you a few examples, a migrant woman in a rural area may face a language barrier, limited mobility, and social isolation. And all these things may happen all at once. This matters at the time, for instance, of designing language services for migrants. Are such services really accessible for people living in the rural areas? Are they equally accessible for people that enter the labor market in a different way and that may be forced to work on shifts that don't allow them to attend language courses? Or moving to another example, young people may face lack of opportunity in rural areas, which may push them to leave rural areas altogether. But of course, this doesn't happen in the same manner for all young people. In taking the decision to live or to stay, their gender, their social economic status, owning land or not owning land may change the outcome of their decision and the process of evaluating whether or not to stay or to live. So applied to rural areas, the other added value of intersectionality that we found out by adopting it in SERIGO is that it helps overcoming the long-time stereotype that sees rural areas as, first of all, the opposite of urban, and as such being always depicted as simple, static, or homogeneous in terms of the rural communities. Very often we hear about rural areas as if they were monocultural realities, right? And by applying an intersectional lens to rural areas, we are able to grasp increasing diversity, unequal power relations also within rural areas, of course. And this has helped us, as we work on it at the moment, in conceptualizing rural areas as much more diverse realities compared to how they are usually depicted. So in rural contexts, intersectionality is not an abstract concept. It shows very concretely who can access services, who can participate, and who can actually benefit from services and opportunities. This includes, of course, also the services and opportunities that are put in place through social innovation and social economy. And this is exactly where the SERIGO project comes in. So how did we mobilize all of this in SERIGO? We approached intersectionality not as a purely theoretical concept. Instead, we used it as a practical lens to improve how we study, and we study the contribution of social economy to overcoming rural vulnerabilities. The first step was a shift in mindset. So when SERIGO partners decided their own case studies, and it was not mentioned until now, but we are carrying out empirical research through 24 case studies within SERIGO in very diverse rural areas with very different services provided to different beneficiaries. So when partners define their case studies and the social economy initiatives they would study during the project, we invited them, first of all, to move away from thinking in terms of fixed target groups. So instead of asking who are the target beneficiaries of the services provided by the social economy, we invited partners to also consider which groups are currently underserved or excluded altogether from the services. Why is it so? And which factors matter at the time of creating inclusion and exclusion from the services provided by social economy initiatives. And to do so, we developed a set of tools which are very practical and easy to adopt. They are visual in their nature, so they are visual supports that we hope could be easily integrated also in the work of practitioners to take, as I was mentioning, a more accurate picture of what's going on around the services provided by specific social economy initiatives and how their services can better answer to the current actual needs of rural communities. Am I still in time, Marisol? Do I still have a few minutes to quickly go through the tools?
If you are fast, yes.
Yeah,
Otherwise,
2 minutes. Just to quickly name the tools that we put together in this toolkit and that are presented also in the deliverables of SERIGO, and you can easily consult them. So we designed, first of all, a social identity map, which is meant for the researcher or the practitioner to reflect upon their own position as they enter the fieldwork. So I'm a white woman, and the experience of racial discrimination, it's not in my lived experience. So if I want to do research about that, I must acknowledge, first of all, that I'm entering the field without an embodied experience of what it means to face racial discrimination. This is a very basic experience that I think most of you can relate with. Then we designed a map which is meant to help whoever is using it to reconsider the stakeholders. So anytime we enter the field, we make a list of the stakeholders. And normally this list does not really reflect upon who is left out, whose voice I did not consider that may provide me key information about why the service is functioning, but only up to a certain limit. So this is about remapping our stakeholder mapping, taking into account also voices that are normally excluded, maybe just because of the fact that they are not considered experts, but they may bring in very deep knowledge about what's going on in the field. Then we provided partners with an intersectionality wheel, which is a visual representation of the different social dimensions that was combination and overlapping generates complex inequalities, and we invited them to reflect before and after their fieldwork about which dimensions matter. So is it gender, is it age, is it a combination of the two, is it about education, or is it land property, and so on and so forth. And by reflecting before and after, we could grasp what we took for granted and what we did not care about enough at the start of the fieldwork. And then there are other tools, just to quickly mention one that is really focused on how social economy initiative works. We know that there is a general understanding that social economy should integrate a democratic governance and represent also the voices of the beneficiaries of the services that they provide. So we gave partner what we call an intersectionality checklist, which was meant to be used by them to really check which social dimensions are represented in the board and in the staff that work for the social economy initiative, and to compare that with the social dimensions that characterize beneficiaries of the social economy initiative. And this, in some cases, led to a very clear representation of the fact that there is huge gap in the governance. So who runs the social economy do not represent or do not share key traits of the social identity of the beneficiaries, which very often is an interesting lead to understand why the service is somehow mismatched compared to the actual needs. So my key takeaway is that intersectionality is not about making things more complicated, it's about making things more realistic. And I hope that the tools that we are currently finalizing to test in SERIGO may be of help and support also for practitioners interested to integrate this perspective into their work. And of course, the deliverables are public on SERIGO's website, but we are also available to give you guidance or explain better how the combination of the tools can support your work. And I will finish here and leave the floor to my colleague Alexandra, who will surely give you even more interesting insights about the the practical application of intersectionality in SERIGO. Thank you.
Thank you. Thank you very much, Marcia. I think it was a great introduction, because we asked her to introduce the topic in a very general way for all of us, not only for researchers, but also for the people who maybe are not that familiar with intersectionality. And I share in the chat also the link to a practice abstract that was developed by URAC, and in which you can find more information about the tools. So feel free to take a look. And also we will have some time for Q&A after the three speakers' presentations. So now I would like to introduce Alexandra Tomaselli, that is also a senior researcher at URAC, in particular in the Institute for Minority Rights and Gender Dynamics. So in SERIGO, she's the main researcher of one of the case studies on social economy and women's shelters in rural areas. I also share the link to the case studies of SERIGO. And she will address what intersectionality means more concretely by sharing her work related to gender-based violence. That is one of the SERIGO case studies. So the floor is yours, and please share the screen. I think you're going to share a presentation. Yes.
Thank you, Marisol, and thank you very much for having me. And thanks also to my colleague Marcia for introducing so nicely the topic of intersectionality and how we have tried to apply it into the SERIGO project. So I have the pleasure today to share with you some insights from the case studies that I've been lucky to conduct within the SERIGO project. So as mentioned by Marisol, it is called Women's Shelter and Rural Empowerment. And you know, as academics, we always start with a research question. And mine was, how does a women's shelter embody the social and solidal economy in a rural context? And this is because, of course, as also Marisol said at the beginning, this is really social innovation and solidarity economy. Social and solidarity economy is really the core of SERIGO. So the hypothesis is that this women's shelter embodies this, offers empowerment services through an intersectional and practice-oriented approach. And through research, I observed that they definitely have a very good practice-oriented approach. They also do it in an intersectional way, perhaps not explicitly, or they don't really realize it directly, but they are open for collaboration and also for learning and for growing. Okay, so having said this, very quickly on the research methods, I conducted 17 semi-structured interviews during 2025 and one photo voice. For those of you who are not familiar with photo voice, super quickly, and sorry for banalizing it, but it's a very nice qualitative method that implies the participants to take pictures and to also provide a short text and a title for them replying to specific prompts that have been provided by the researcher. You can also look for further information also within our guidelines that we have developed for the fieldwork in SERIGO. The photo voice in my case was done with 4 beneficiaries of the women's shelter, so women victims, survivors of gender-based violence, out of which one is local women in inverted commas in the sense that is South Tyrolean. And so from the province within which I've been conducting this study, and 3 have a migratory background, which means a citizenship different from Italian, or with parents with citizenship different from Italian, or that recently entered into the Italian South Tyrolean territory. I have analyzed all the transcripts through en vivo, of course, applying the SERIGO approach, semi-grandi theory, and using, of course, as Mancia said, our intersectional critical system thinking with, as Marzia said, with a strong focus on reflexivity and positionality, also on how our research is situated, both in terms of time and in person. And if you have questions on this, maybe we can discuss them later. But I would like now to go into the initial research findings of the case study. So a quick, perhaps not so nice map, but just to understand where South Tyrol is in Italy, is very close to the border with Austria, is a very wealthy province, also has a very strong self-determination, autonomy powers, and but it's apart from the main urban centers, it's quite many rural areas that, despite the wealth, there are a lot of complexities going on, as you know, and as also mentioned by Matt already. There are social, cultural, economic, and infrastructure challenges that are all interconnected. And in this case, also in our case, vulnerabilities are layered and mutually reinforcing. In this regard, in my case study, both local and migrant women, and the forms of gender-based violence that they are exposed to, that they have lived, can be physical, sexual, but in the majority of cases, it's psychological or economic, and or also a combination of those. So in the case study, the main drivers are intersection vulnerability, of course, gender, migratory background, migration status, or also legal status, age, class or socioeconomic status, education level, and also religion and cultural norms that can combine all of them, part of them, and in the different situations, as also mentioned by Marzia before. What is important is that they only interact, but they also reinforce each other. So as Marzia said, it's not really simply adding layers, but it's really the combination of these layers that really intersectionality teaches us to unveil and to also understand how this creates further power asymmetries. So the main challenges that the case studies I've observed is that being, in some cases, also remote rural areas, there are very strong family and land attachment. And this can be observed both in the case of local women, in the sense that they are also somehow, within this family and land attachment, while migrant women are sometimes excluded. There is a strong social isolation that regards both of them. Local women maybe can be really integrated into these close-knit communities on the one hand, but on the other hand, this becomes sometimes a kind of prison for them. While of course being so close knit communities, they tend to exclude people that are not autochthonous. Overall, of course, being so close, there is an overall lack of anonymity and discourage gender-based violence reporting. Moreover, these rural areas is a beautiful area with the Dolomites, with a lot of tourism also, and it tends also to be romanticized by local people as idyllic. Which also implies masking problems and issues, including gender-based violence, that remains hidden, taboo, and often normalized, and is, of course, seen as a private matter. And there is also many victim-blaming attitudes towards women. This is further compounded by the fact that gender roles are seen still very traditional. There is a lot of expectations on women, and especially their care work and also the informal labor, which helps to, on the other hand, have more flexibility for the care work, is not only unpaid but also undervalued. There is a limited awareness of available support services, even women's shelter. People, also because it's a taboo and it's a private matter, some people, not only, and women sometimes don't want to go. There is this lack of anonymity, so they're also scared to go because then the neighbor will tell, or the community will talk about this situation, and so on and so forth. But it's sometimes also like a limited awareness of the services. And moreover, at the same time, there is mistrust and stigmatization of social services in general. So they shouldn't, social workers shouldn't care, shouldn't go into the private matters. So with regard to economic infrastructure challenges, as also mentioned by Marzia, sometimes there are limited transport, although it's a province that provides quite good transports. Sometimes accessibility in some areas can be extremely problematic, especially to reach different social services, including the women's shelter. There is a widespread economic dependency on partners and family, so a lack of financial literacy and financial autonomy. There is also an increasing complexity within gender-based violence due to the combination with other addictions, so both on the part of the abusers, but also on the part of the victims and survivors. And what I mentioned also quickly, the touristification, really huge touristification of the area, which has a strong impact on housing, not only in terms of availability, but also renting costs that had really gone extremely high. And this is, of course, becomes a greater barrier for women with children, and further compounded by migrants and migratory backgrounds. So those are considered absolutely, how can I say? So they are not considered to be good renters, let's say. affordable and trustful renters. There is also issues in terms of jobs, so they demand also flexibility, of course, in tourism, which is often unattainable for women survivors of gender-based violence that have children, and majority of them have children. And there is overall an economic degradation of the territory with repercussions also on transport. So quickly from the photo voice, I also wanted to share with you some of the pictures that the women survivors of gender-based violence have took during the photo voice. They see the women's shelters as a place for hope, security, and they feel welcome, also self-empowered, and that in the life there is much more than only grief that comes from their, of course, lived experience of the violence, and the women's shelter can be a springboard. But of course, at the same time, they see also the challenges that we've just seen, that the pressure, and that they feel that they need more time to find a house, to find a job. They also feel powerless vis-a-vis the housing crisis, and also the need for more creativity. So this somehow having less pressure and more time to be creative. So if you want to understand intersections here, we see in the case of the migration status, often there is this intersection, of course, of gender migration, but also class and education, and key barriers are language difficulties. This is also a multilingual area that requires the learning of Italian and German, and sometimes also of other languages, lower education, sometimes illiteracy, and also very precarious socioeconomic conditions, compounded with processes of othering and social exclusion. And if we look at also of local women, then there are also other factors such as the level of education. When the level of education is low, of course, women are further disempowered. But when there is high education, and really speaks well about the transversality of gender-based violence, is that there are more incisive cases of psychological gender-based violence. Age, of course, so when women are young, maybe naive, unexperienced, but when they're older, they are disempowered by long gender-based violence-related segregation, and of course, they have been out of the job market for a very long time in many cases. And then we have religious and cultural norms that essentially normalize gender-based violence, as also mentioned already, and of course, then foster underreporting. So some final thoughts. Of course, as well known, I think women that intersectional multiple axes face greater exposure, especially in rural areas. Vulnerabilities are not isolated, but systemic and interconnected, as also Marcia said before. Gender-based violence is absolutely transversal, exacerbating the intersection of factors, and also compounded by cultural norms and the strategization of support services. And as sadly expected, this is expected, intersectional context-sensitive approach is essential to address gender-based violence in rural areas. And what is positive in the case studies is that although there is benign paternalism, the women's shelter is receptive, or intersectionality is learning how to approach it. So I also so far got a good feedback on data validation restitution. I'm still working on the final report, but yeah, let's say that also the connection I have created with the women's shelter is positive, and hopefully also this research will be helpful for them. And I will stop here. Thank you for your attention, and yeah.
Thank you very much, Alexandra. I think it's a very, very good example to understand how different overlapping challenges are affecting women. In this case, it's not related to women health, in which we will speak more in the second session of the webinar. But it's a great example, and thank you very much for sharing your results. And now I would like to move forward with the agenda and to present Monica Grau Sarabia. She's a researcher, also senior researcher from Universitat Oberta de Catalunya, and she's specialized in economic justice for women, empowerment, and institutional transformation. And she will give us also additional insights on intersectionality by sharing the work they are doing in Inspire Quality EU-funded project, in which we will share the link in the chat for those of you who don't know it and want to know more, but I think Monica will speak more about that. So the floor is yours. Thank you. I think you're muted, Monica. Sorry.
Sorry, thank you very much, Marisol. Can you share my screen, the presentation? Can you see it?
We see it.
Oh, okay, thank you. So, yeah, let me, okay. So, well, thank you. Good morning to everyone. Thank you for the invitation to this webinar. As Marisol said, I'm a senior researcher at the Universitat Oberta de Catalunya in Barcelona. I'm working the INSPIRE project. So now I'm going to very briefly present the INSPIRE project and more specifically how intersectionality was approached from our project. So INSPIRE stands for Europe's Center of Excellence on Inclusive Gender Equality in Research and Innovation. That means that we work with universities, private, public, across Europe, and research institutions. And we are also an Horizon Europe project. Our mission is to go beyond the standards of gender equality plans. I guess that you are all familiar what a gender equality plan is. It's one of these tools that universities have to now, for instance, it's mandatory to have if you want to participate in a European project. So what INSPIRE wants to do is, as I say, go beyond of these traditional gender equality plans and develop like more inclusive approach that takes into account all the different ways that people can experience inequality at the same time. We have 13 partners across Europe, as I say, different type of universities and research institutions. And we also have like 4 thematic knowledge and support hubs and 12 community of practices, as you, involving more than 95 institutions. So one of our hubs, as I say, there are 4 hubs, and one of them is specifically focused on intersectionality. So this is the one that I'm going to focus, obviously. These hubs explores how organizations, how universities and research institutions can go beyond of simply counting, for instance, how many women are in leadership positions or how many women are principal investigator of a European project. This is like a traditional question from a gender equality plan, but what we propose is like more is different because it's epistemologically different. The question is which women are in leadership position, for instance, or are we reaching women who face multiple barriers at the same time, or other people? So it's obviously now our interest is not just about the participation of women and men, but the different people who are participating and their characteristic. So they have support communities of practices across Europe with training, with case studies, as you are doing with practical tools. And it works specifically also with the countries that are new in the implementation of gender equality work. So the idea is to spread the knowledge from those who are more who have more practice to those who are starting to do the implementation of these gender equality plans, and also from an intersectional perspective. Obviously, I'm not going to talk about what intersectionality is, because my previous colleagues, Marcia and Alexandra, they did very nicely. I just want to say that for us, obviously, intersectionality, we assume that people have multiple and overlapping social identities, not just race, but not just gender, but race and class and disability and where they live, etc. And all this doesn't operate separately. So they interact. This is something that is a message that we have to highlight all the time. No? And for us, a very important leap is to try to understand how power shapes experience of people. This is what we are going to. We have been trying to do all through the project, is to understand how people live these experiences. And because we work in a research institution and universities, the experience involves also the knowledge that is created through these experiences, the knowledge and the ideas. Right? So, so let me, yeah. And when we try, obviously, to put intersectionality in practice, we have to face many challenges, like I imagine that you are also doing. And I want to highlight like 4 main challenges that we found and we faced. The first is sustaining the momentum, because obviously it's not just enough to write it into a document. That we want to do an intersectional analysis. It requires real change, requires embedding intersectional thinking into institutional cultural leadership. And, you know, in our cases with universities, this is really, really important to have the support from top positions, obviously. The second challenge is the contextual sensitivity, and I think this can be probably one of the most important, because intersectional analysis is not just a plug and play tool. It cannot simply be a copy from one place to another place, and this is a challenge that we all face, no matter where the project is or where the research is situated, but it's always going to be a challenge if we want to do intersectional analysis. And the third challenge is that there is a real lack of know-how. And we could see it in many organizations, many universities, they are willing to do it, but they don't know how. So this is something that we have to admit, that we are in the process to develop how to do it. And obviously it was one of the main goals to try to fill in this gap. And the fourth challenge that is more specific for Inspired project, because it's based in universities and research institutions, is how to implement the gender innovation, and how to make sure that the gender and sex variable analysis are not just are embedded in the whole process of a research and knowledge creation. It's not something that is added at the end of a project, for instance, but go through the whole cycle of a research process. And I want to just spend a little bit more time in the second challenge, the sensitivity of the context, because obviously this is, as I said, something that can be understood in any project with trying to implement intersectional analysis, because intersectional analysis is by definition a situated framework. It maps the specific configuration of power and identity and structural disadvantages within a particular social location. And because of that, what works analytically or practically in one context cannot be simply be transplanted into another one. In our case, with the gender equality plans, we could see many times that what is working, for instance, in a big public university in the Netherlands may be not effective at all, or even counterproductive in a smaller university in a rural area of Poland, for instance. No, and it's not because the measure is not itself a good one, but because obviously it's not specific for a particular context. So what does it mean in practice? It means that intersectional analysis for us, and I will say for everyone, cannot be scaled through replication, and that's something that we have to admit, obviously. You cannot copy and paste a framework. It scales through situated and context-specific development, and without ongoing. It requires the ongoing dialogue all the time with local actor, with local knowledge, with local power structure at every single stage. And this is something, this is, I will say that this is the great methodological challenge of intersectionality. But at the same time, I think this is the greatest strength, because it forces the researchers and practitioners to take seriously the specificity of people's life. Yeah? And so what do we actually do? No, if we want to just mention some of the tools that we have been using, and I think some of them are common with the SERIGO project. We first developed new indicators for inclusive gender equality plans, because, as I said, binary indicators are not enough. So to capture the different dimension of inequality, as race, disability, etc. So we need to develop new indicators and better data. Sorry. The second is that we run a pan-European monitoring survey, mapping which institutions have gender equality plans and how well they work and where the intersectional gaps are, to learn from each other. The third was to do, as you are also doing, like deep dive case studies to learn real examples across different national contexts. So we want to know what works and what fails and why. No? And then we have the community of practices, as you and in SERIGO you have also. 12 groups across Europe with practitioners sharing different tools and testing ideas and building on each other's experience. No, because we can see how this peer learning is very valuable and for everyone. So we also develop customized training practitioners for researchers and policymakers. And finally, everything that we learn fits directly into EU policy recommendation. And in fact, it's not been published yet, but it will be published in the website. This policy brief, written by Rachel Palmen, which is the principal investigator, the research coordinator of INSPIRE. And I wanted to highlight some brief examples of practical actions that organizations have taken to promote equality across multiple identities. Obviously, we cannot go into details, but for instance, the first one, the reverse monitoring, I think is quite illustrative, because if you know this mentoring normally flows from top down, like a senior person teach a junior one. And here, with this activity in this university, they decide to do it in the opposite way. Let's say like a white person, a person with a power, is mentored by someone from a minority, is mentored by a minority colleague or a Black person. So the goals here is not to teach professional skills, but to build genuine understanding of racism and discrimination from the lived experience of those who face it. No, so the challenge, it challenged this kind of reverse mentoring, challenge the assumption that those at the top already know absolutely everything about the equality, and also give real voice and influence to people who are usually ignored in this kind of conversation. Yeah. So you will you can find more example, like more concrete activities out as a result of intersectional analysis in the implementation of gender equality plans that are described in this policy brief. And so I think we share, as I said through my presentation, I think we share SERIGO and Inspire share many things in common. And both institutions both projects approach intersectionality as a tool for equality. Yeah, that's for sure. And just to finish my presentation is some of the key messages I want to share with you from the Inspire project is that obviously, as we said many times, intersectionality is not about theory. It's a practical tool, and it's a tool to ensure that no one is left behind, that we include everyone. But for doing this, one of the challenge is that we need better data and new indicators. And at least we realized, and another important thing is the community of practices, that this peer learning across institutions produce like lasting change. So just to end my participation, I would like to give you some the contact details in case that you want to learn more about Inspire or reach out with any questions that we would love to hear from you. And yeah, thank you again for the invitation of the webinar, and I hope well it proves a very valuable inspiration for all of you, and that you can take away ideas and insight to put in practice. So thank you very much, and that's it.
Great, thank you very much, Monica. Also very interesting for us to learn more about Inspire project. So now I would like to invite all the attendees to see if they have any questions for Monica, Marcia, or Alexandra about their presentations. So feel free to write in the chat or just raise your hand so we can give you the floor. But I already saw one question for Monica, that is, how long will Inspire project run?
Yeah, in fact, it is finishing it will finish in September, this September 2026. So it has been for more than for almost 4 years, but it's ending now.
Great. It will be maybe useful to see if you're organizing any final events or something that
we just did it. We did it like
okay.
2 weeks ago. Was the final conference in Brussels. Yeah, it was really successful. And it was good. And this is something that we learned, that it was really interesting to do the final conference 6 months before ending the project, because doing the conference at this time, it gave us time to wrap up and to make another, to do more activities. Like, for instance, one of the main goals that now is to do knowledge transfer, how we can transfer what we learn to other institutions. And thanks to this final conference, we learn we get some ideas about the knowledge transfer, and we still have some months on ahead to work on it. So I would recommend you to think about this strategy of doing the final conference before the real final of the project.
Great. Well, that's also a very important part of the projects, no? The replication. Well, you said that maybe not replication, but transferability, no, of the results and sustainability after the project ends.
Exactly.
I see another question for Marcia. Is that if you can maybe explain a little bit more about the social identity map that you develop within SERIGO?
Sure. Thank you for the question. So basically, we integrated into our methodology this tool, which was developed by Jacobson and Mustafa. There is a paper by them dated 2019, and it's meant so as a visual support to support the researcher to map her own social positioning. This helps to clarify how we approach the field of research. It also helps us reflect which may be our interests and which may be the black corner that we don't focus on due to our own positions. And basically, I don't know if I can do you think I can share the screen quickly?
Yes.
Just to show it. Okay, because I have it here from another presentation. So this is it, basically. You should be able to see it now. There are these areas, dimensions. It comes as an anti-map, and the researcher is asked to fill in details about our own class of origin, citizenship, and so on. And then in the smaller squares to detail how this may impact the way she interacts with the research topic. The way we design it, because it's filled with very personal and sensitive information, it is not meant to be shared with the whole consortium, although it is part of the research design, but it's meant to be stored by the researcher as a reference to which he or she can go back during the fieldwork to see if something was overlooked, or maybe something is becoming, some traits of the social identity are becoming even more salient as the fieldwork moves on. I hope I answered the question.
Great. Thank you, Marcia. Thank you also for sharing the screen so quickly. There is another question for SERIGO, like Marcia, Alexandra, or SERIGO partners who are also connected. So the question is, if within SERIGO, do you also address politicians as specific target groups in order to tackle the structural inequalities and interconnection you reveal in rural areas? I don't know, Marcia or Alexandra, if you want to reply.
Shall I go? I mean, okay, we're working in Southro, which is a very, also, let's say, small province in the sense that everything is very much, I mean, all the politicians and services, often they know each other. In my case, I mean, we've been also identifying stakeholders to be interviewed belonging to, let's say, to the provincial level, to the provincial government, and also as an exercise to identify whose voices may be forgotten and might be useful. So as Marcia also said at the beginning, at the end, I also interviewed one person from the police, which was extremely helpful and quite surprisingly extremely in line with the view of the women's shelter. So I also had really the impression that sometimes single persons may be extremely aware and also sensitive to many issues. Of course, they are very well embedded into their institutional, let's say, position and positioning. But yes, they can be much more open than expected. Then as a target group, in the sense that if we approach them, beyond interviewing them, we had the idea of translating because our case studies, the report, our case studies will be written first in English. Of course, this is a requirement for the project and the EU rules, but we also aim to translate it into the local languages, so Italian and German in our case, so that can be also an instrument. For example, the women's shelter I'm working with, they already shared some of the data restitution with their how it's called, with the department, I mean the higher department, so also to show what are the challenges also that they face out of this the research. I don't know, Marzia, if you want to add something on this.
Well, your answer was already very exhaustive. Maybe I can give an example of the way in which through this stakeholder remapping, we paid special attention to make sure that for a given dimension we want to explore, we had different standpoints. So in my case study, which deals with migrants' housing exclusion, I was interviewing both local politicians, social workers, migrants residing in a housing provided by a social economy initiative. And by comparing and contrasting the information that is given on a certain topic by these different subjects, very interesting elements come out. Concretely, I recorded very often from social workers and local politicians the fact that migrants are isolated, they don't have a social network, so this constitutes a big challenge at the time of entering the labor market, the housing market, or to find a house. And at the same time, from the side of people with a migration background, I recorded the fact that they often find a house thanks through the informal social networking that they were capable to build in even a few months after their arrival. So this is an information that need to be considered. I mean, there is no one reality. It's not that one is true, the other is false, but I find very useful to analyze these two positions all together. It says something more about the phenomenon being investigated. That would be my 2 cents on this.
Great, thank you, Marzia, and thank you, Alexandra. I think it's very interesting, no, to have these different point of views of different people, as you said, like migrants and politicians in this case. And I think as we are a EU-funded project, we also address policymakers in general in our activities, and that's why after all the work that we will develop, like all the deliverables and reports on the case studies and the pilots, we will create also policy recommendation more at EU level to improve EU policies or to contribute more than at local, but also in some pilots we work with the municipalities, no, as in the case of Slovakia, for example. So, well, I think we have another question for Monica. So you have in the chat, so you can read it, but I will read. My question is for Monica. The reverse monitoring sounds very promising in an open for change and willing setting. Power relation and inequalities are often denied by those who profit from them. What would you recommend how to deal with this, or how do you deal with it in Inspire project?
Okay, so power relation and inequality are often denied for those who profit from them. Yeah, again, there is not a unique answer, and there is not a simple answer, because as we are saying all the time, this has to be situated in the specific context. So if the cultural and the leadership of an organization is completely denying the inequalities and denied and not recognizing and not aware about the their privileges, it's difficult to do something, obviously. So there is a long, there's a path to start from your current situation and to move on little by little. In our cases, we are talking about research about organization that had already a gender equality plan. So in a way, they are willing to achieve equality. From this engagement in equality, it's easier to work with, obviously, and a sensitivity of those who have the power can be more ensured, obviously, but yes, but there's no, I cannot say a recommendation that can be applied to a different context, no, because as I said, I think perhaps one recommendation is not to get frustrated because what we try to do is really, really difficult. It's a big challenge. And when those who have the power and the privilege, they don't see it, we cannot change completely the mindset of people's mind and organization and culture from one day to another one. So it's just, it requires time, it requires a strategy. So that's probably the advice I can give. I don't know if it's helpful or but
Yes, thank you very much, Monica. So I think as I don't see any more questions and we are also already a bit behind on the schedule, I will move on to the next panel. But first, I would like to thank you very much, Monica, Alexandra, and Marcia, for the great presentations and insights. And in particular, I also learned, so thank you. And if you have any other question, feel free to write in the chat, or you can also address them directly. As Monica, Lisa, and Alexandra share the contact, or I can also share after the event that you have my email. So thank you very much. And I will move on then to the second panel, and in which we have 4 speakers. And here, in particular, in this second session, we will present concrete examples of projects that are related to access to women's health, and that are also addressing intersectionality, especially women, and also it's like Marcia explained at the beginning, just living in rural areas with all the challenges that their experiences could be also an additional challenge. So here we have Begoña de la Iglesia, Gloria Voltolini, and Belén Serrano. They have been working with the Spanish Society of Family and Community Medicine, SEMFIC, that is the largest scientific society in Spain and promotes the development of family and community medicine in Spain. So we have 2 regional projects that they are going to present. One is in Castilla-La Mancha, and the other one is in Spain. And finally, we will have Miroslava Bobakova, that is from Czech Slovak Women Fund, and she will speak particularly about different challenges experienced by Roma women in rural areas. So I think I would like to give the floor to Begoña, but I think she had problems with the audio, so we will check if we can hear her. I hope you can hear us.
I think
Begoña?
it's okay. I think it's, I can, yes. Now we manage.
Okay, great. Thank you so much.
I got it.
I think my colleague Sophie, maybe you can share Begoña presentation.
Okay.
Yes. Begoña is a family physician working in a rural area where she engages closely with patients, families, and the wider community. And she's going to present one particular example of Women's Health Days as an opportunity to build community. So I think, Begoña, you can start now. Thank you.
Okay, thank you. Hello, everyone, and thank you very much for being here today. How do our presentation? My name is Begoña. I'm medical coordinator at Los Naval Morales Health Center, and today I'm going to present this community health experience, small experience, but this is not just a health intervention. It's a way to connect people in their community and reduce inequalities in our rural areas. There is a place in La Mancha whose name I do want to remember, Los Naval Morales. This is a rural area in central Spain with around 5,000 inhabitants distributed across 10 small villages. It's geographically dispersed and located about 40 minutes from the nearest hospital. In this context, women often face specific challenges that affect their health and well-being. This includes geographical isolation and limited access to healthcare resources, but also social factors such as the traditional role of caring for others, and this often means they pay less attention to their own health needs. As a result, this increases vulnerability and reduces quality of life. This is why it's essential to promote approaches that empower women, giving them the tools and knowledge to take care of their own health. And this is exactly where our initiative begins. The idea did not come from us, it came from the community. Women association from the area approached our community health school with concerns and different questions. So instead of design something ourselves, we decided to listen first, and we carry out a survey with women from different villages. And nearly 1,000 more or less women respond. The results were then shared in a health board with association, local councils, and organizations such as the Red Cross. Together, we designed the workshop based on real needs expressed by women themselves. We asked what affects their health, what helps them, and what topics they wanted to explore further. As you can see, the topics identified were both physical and emotional. This includes pain, physical inactivity, and lifestyle factors such as diet and alcohol, but also stress, mental health, menopause, and sexuality. There are topics that often not openly discussed in rural settings. The next, please. Based on this, we define several objectives to raise awareness about women's health in an holistic way, to improve knowledge of local health resources, and build community connection. The event combined talks and practical workshop. Local professionals like midwives, physiotherapists, doctors, and nurses took part to cover the key topics identified in the survey. For example, menopause, incontinence, sexuality, and healthy aging. And we also include activities like Zumba, yoga, Pilates, and pelvic floor exercise. The aim was to create a dynamic and participatory environment. In addition, we organize more interactivity activities, such as healthy eating workshop called Build Your Healthy Plate. You can see the women with the nurse, and vivid frail session to prevent frailty and falls, and a health in Cana focused on prevention and health habits. We also share a community meal and include a cultural activity. So it become more than a workshop. As you can see, it became a fun community experience. The event brought together nearly 300 participants. It created spaces for the dialogue between association, institution, and health service. Participants not only receive information, in my opinion, but also felt more connected and empowered. This model can be applied to other rural settings. It helps address loneliness, so important, mental health challenges, and chronic condition. And it shows that community itself is a key health resource. If we want to improve health in rural areas, we need to go beyond services. We need to focus in people, relationship, and community. I don't know if we can see, here's a short video showing the experience. Yeah. I don't know if we can see the video. Is it possible to see the video?
Maybe you have to press on the image. Yes.
Yeah. We can listen the music, but it's okay. This is the local, the different activities. The women were very comfortable to participate in every activity, in all the activity. We can listen to the music, but it's okay. And that's it. Okay, thank you very much for your attention.
Thank you very much, Begoña. Thanks a lot. I think it's a good example that have this holistic approach to health, in which you develop like different activities. So, and also I think it was very interesting for us that it was an idea from the community. No, this community-led approach. It's always very powerful, and you see it with 300 participants. No, that you had. So now I would like to move on to the next presentation. Thank you very much, Begoña. We will see if we have some questions like at the end of the panel. And now I would like to give the floor and introduce to Gloria Voltolini and Belen Serrano, that they will explain, the two of them, the project called Circe Al Sports. I don't know how to pronounce. It's from Valencia. And they are both third-year resident in a family and community medicine, currently working in Rural Health Center of Villarreal in Valencia. And they will explain a project in which they are addressing mental health of women in rural areas. So the floor is yours. Thank you.
Thank you, Marisol. Good morning, everyone. We really enjoyed Begoña presentation and video. Well, first of all, I would like to thank you, the organizers, for the opportunity to present our work in this webinar. Today, as Marisol said, we are presenting the Circe project in El Sports, a region in the province of Castellón, Spain. Well, my name is Gloria, this is Belén, and we are both intern residents in Villarreal and now currently working in Morella. And well, this project is promoted by Conselleria de Sanidad and coordinated by FISABIO, which is a foundation dedicated to the promotion of research in primary care. To begin with, I want to briefly describe the context of the Elsports region. As you can see in the map, Elsports is a rural and mountainous area with a population of 7,075 inhabitants distributed across 17 municipalities. And the important part is that 8.72 approximately percent of population lives in isolated rural farmhouses, which reflects the geographic dispersion and the challenges in accessibility that we have. The region is organized in 3 basic health zones with 3 health centers and 15 auxiliary clinics. And it depends on two two health departments, Vinaroz and La Plana, and is characterized by a strong sense of community cohesion and intermunicipal collaboration known as Manco del Sports. The main objective of CIRCEJA is to transfer and implement the 6 selected best practices in primary healthcare across 4 European member states, which are Belgium, Portugal, Slovenia, and Spain. Which is the objective is to strengthen the healthcare systems through reinforced primary care. The aim is also to emphasize on health promotion, prevention, and community-based approaches. This is the list of centers that are implementing the best practice number 6. And these health promotion centers are important for us because are integrated in primary healthcare structures and offer free structured lifestyle intervention programs. These programs address to behavioral risk factors, including healthy nutrition, physical activity, mental health, smoking cessation, and alcohol consumption. As a result of this model, this Slovenian model, was observed a 99% reduction in premature mortality for cardiovascular diseases between 2006 and 2015. And now Belén will follow.
Hi, everyone. Sorry for the technical problems. And now we will discuss how we're going to implement this Slovenian health promotion system in our region. Firstly, we must identify the lighthouses, centers of best practice in health promotion, which will be designated as CIRCE health centers. The requirements to qualify as a CIRCE health center are as follows. We need accreditation as a teaching center for medicals and nursing. We need a location within a municipality affiliated with Charcha Salud network, and availability of a space for active community participation. Also, a strong and motivated team, and currently developing at least one health program and being able to initiate 1 or 2 additional programs in the coming months. Within our autonomous community, these were the health centers that met the above criteria. And ours is the last one, and it's the only rural one. We will now explain how this was implemented in El Sport. Our program, Emotional Wellbeing, was based on the group work and on the experience gained from the project A Step Towards Mental Health in El Sports. 3 localities participate: Villafranca, Forcada and Morella. A total of 8 sessions took place in the afternoons, with 2 coordinators assigned to each basic health zone. These professionals had recognized training in the subject area and also receive external support from, for example, a private psychologist. This was the timeline we followed, 1 month of training and information in the different health centers, followed by a 3-month implementation phase, and finally 1 month dedicated to evaluate and know what the outcomes assessment. These were the 3 emotional well-being workshops carried on in sports. Um, and uh, fi- yeah, this is the content of the sessions. One for the welcome, two resource around me and one can help me, working on their needs, coping difficulties, and the last one is for evaluation. Finally, here are some photographs from the sessions. And we wanted to bring this session to a close by reviewing the evaluation and the results of this program in sports. On the one hand, the quantitative evaluation showed that 36 women participated, up to 69% of healthcare professionals were involved, and 6 regional sectors were engaged: healthcare, local councils. And the evaluation reported that 89% of the women attended more than 80% of the sessions, with 69% reporting a high level of satisfaction with the program. On the other hand, regard to the qualitative analysis of the program, the following aspects were examined: material and human resource, implication and coordination, benefits, group dynamics and relationship, professional community relationship, and also the challenges and facilitators for the program. One of the challenges was the lack of time, the outside working hours, the preparation workload, and one of the facilitators, the proximity, the accessibility, the community integration, and the motivation. Gloria will continue with.
Well, to conclude with the main conclusions regarding quantitative results, we observed a significant improvement in emotional well-being. We measure it with 2 scales. One was the Goldberg one within the advocacy system, which is our program of 2 clinical histories. And improve was detected in more than 75% of participants. And the other scale was a self-perceived health status and show improvement in more than 39% of participants. Regarding qualitative results, we identify changes at different levels. At the individual level, which is so important, participants report greater awareness and control of their thoughts and emotions, with improved management of rumination and a greater sense of calm. At the level of their immediate environment, partner, family, friendships, they reported improvement in relationship in general, but also because they transmitted increased self-confidence and also a greater ability to express their needs and preferences. And finally, regarding the changes in relation to the health center and its professionals, participants also reported increased trust in professionals in us, and also the professionals which participated described a greater sense of closeness with participants from other groups, and the development of peer relationships outside the clinical setting. In fact, nowadays we are seeing them with coffees, and we can talk about our progress, etc. And to conclude, this project has demonstrated positive impacts at both quantitative and qualitative levels, reinforcing the value of community-based health promotion. Thank you very much for your attention. Vale, ya le quito esto.
Thank you. Thank you, Gloria and Belen. I know they had problems with the microphone. That's why they have to change that. But thank you very much for to manage and to present this good example in which you transfer a best practice. And now I would like to move on to the last speaker, that is Miroslava Bobakova. Miroslava is an interdisciplinary philanthropist, anthropologist, and educator, serving as executive director of the Slovak-Czech Women Fund. And for more than 15 years, she has advanced the human rights of women and girls by supporting feminist movements and women rights organizations. And her expertise is it's wide, but focus on gender equality, human rights, Roma inclusion, and social inclusion in general, and education. So I think you are not going to use presentation, but you will explain us. So the floor is yours, Miroslava. Thank you.
Thank you very much. First, thank you for having me here. It's both pleasure and privilege to share experiences and my work and our work. So I came from Slovak-Czech Women's Fund, which is very specific philanthropic organization. It was established in 2024, more than 20 years ago, to support women's rights organizations, initiatives, and women's rights groups in both Czechia and Slovakia. And over more than 20 years of operation, we've supported more than 300. We awarded over 300 grants. And we hope that we contributed to the advancement of gender equality and strengthened civil society in both countries. We support organizations that work in areas such as sexual, reproductive, and parental rights, prevention and elimination of trafficking in women and girls, advocacy for the rights of women from marginalized and disadvantaged groups, support of activism, prevention and elimination of the violence against women. So it's really broad range of activities organizations we support do. And we also work with the concept of intersectionality, knowing or being aware that the effects of ethnic, gender, and class categories have effect on the lives of women, and that women are not homogeneous group of single individuals, but they are unique in their experiences and identities, constructed and situated in a historically and socially specific contexts. So this is our organizational background. And when it comes to women's health in rural areas in Slovakia and Czech Republic, and specifically when it comes to Roma women's health, I will be speaking more about situation in Slovakia, where we face specific and well-documented challenges when see Roma women and their reproductive health and rights. And when looking to the context and reproductive health challenges, even our reports and our work and other reports consistently highlights issues such as discrimination in healthcare in general. I mean, in general, but in particular in segregation in maternity wards, verbal abuse, poorer treatment in hospitals, Then we can see lack of informed consent and communication barriers. Then history of forced illegal sterilization. Its situation especially pre-2000, but with ongoing justice concerns because women, they still lack of recognition from state institutions. We can see limited access to services because of distance, costs, lack of transport, lack of information, and high-risk pregnancies and poorer health outcomes are linked to social exclusion. So, as I mentioned before, Roma women are affected simultaneously by ethnicity, gender, socioeconomic status, and it's often described as intersectional discrimination. However, our approach is to be more focused on their strategies, steps, and actions that enable Roma women to break the cycle of discrimination, and seeing their identities and contexts as opportunities for both individual and collective development, growth, and change. So when I looked at projects and initiatives in Slovakia, they can be divided into at least 3 categories. First domain of projects and initiatives are focused on rights-based advocacy and legal initiatives, with a focus on advocacy towards state institutions and policy change, towards documenting lived experiences and planning joint actions, and on connecting and strengthening collaboration and network between Roma women activists, NGOs, even international human rights actors. So this is this area of rights-based advocacy and legal initiatives. The second area is empowerment and community-based projects, focusing on capacity building of Roma women leaders, linking also health, and empowering women's ability to navigate their systems, and also healthcare systems and claim rights. So it has to do with community organizing and community building activities. Another focus is awareness of gender equality and women's rights, linking reproductive health and addressing social norms as well, like, I mean, concretely, like early motherhood, gender roles in Roma community, because they also shape health outcomes. And the third area of projects and initiatives is focusing on research and knowledge building, or knowledge generating initiatives. And these explore identity, values, life perspectives of Roma women, their needs, and also emphasize that policy must be based on women's own voices and inform evidence-based and culturally sensitive policies. So this is kind of nature of project and initiatives we've been supporting, also other, let's say, sister organization support. When I look at approaches and frameworks, these projects, initiatives, or actions and activities are based on, so several common frameworks emerge. The first one is, of course, human rights-based approach, seeing reproductive health framed as a fundamental human right. And it's and when it comes to concrete projects, it's about informed consent, what it means. It's about meaning, creating meaning, about human rights and women's rights. How is conceptualized dignity in healthcare system, accountability for past abuses. So it's really this type of approach. Then it's community empowerment and participation. Roma women in these projects are trained as activists and involved in decision-making processes. And we support and we see moves away from top-down interventions and emphasizing more participatory approaches or participatory work where women, Roma women, are directly involved in strategizing, in planning. Then one of key approach is also capacity building and education. Roma women are trained in health literacy, advocacy, in leadership. And also the last one is institutional change. When through advocacy activities and through capacity building and capacity development activities, they target also healthcare system, legislation, and anti-discrimination enforcement with bigger or smaller success. Of course, we see gaps and ongoing challenges. So despite these initiatives and long-term support, we still see implementation gaps in healthcare equality. Still, compensation for sterilization cases remains incomplete, and the responsibility of state institution is still, we expect more initiatives from state institutions. Then we see segregation and discrimination, which is still reported in practice, and also limited access to preventive and reproductive services directly in rural areas. So my key takeaways are that when we think in Slovak Czech Women's Fund about inclusive strategies for women and girls who face health challenges, we think that we should understand their lived realities. Then together, this is ideally, together with them, try to imagine different inclusive strategies and finally together design action. And this is kind of framework we work with, knowing or being aware again that Roma women's reproductive health, and I mean in general, women's reproductive health is multi-layered and contains legal advocacy addressing rights violation, community empowerment, addressing strengthening agency, or is much more focusing on strengthening agency of Roma women. When it comes to education and research, it's about improving policy relevance, and we also seek to support international frameworks or international cooperation between Roma activists, Roma women activists, and NGOs in order to support this systemic change. So for us, it seems to be that the most effective initiatives combine all four dimensions, and especially those that center or are focusing on Roma women's own voices and leadership. So thank you very much.
Thank you very much, Miroslava. And thank you to all our speakers of this second session. So now I would like to open the floor and to see if there are questions or comments from our participants, either to Miroslava or for Belén, Gloria, or Begoña that presented before. So feel free to write in the chat or to raise your hand if you have any comments. We have just 5 minutes before I wrap up the webinar to address any any questions. Yes, so you can check the chat. Okay, so I see there are a couple of questions for Begoña, Gloria, and Belen. So I think Miroslava, maybe you can ask them directly, as I think you wrote the question.
Yes, yes. Okay, that's my question for you, my colleagues from Spain. How do you work with how do you cooperate and work with municipalities? The idea came seeing pictures from Begoña de la Iglesia, because these 300 participants were in spaces, in rooms, in maybe halls, and I'm interested in this like multi-stakeholder cooperation. Who are your partners? How do you work? How do you work and cooperate with them?
I think in our area is easier because there are very small villages. I think we know each other. I know the responsible for the ¿cómo se dice? Ayuntamientos. Marisol.
Municipality.
The municipal. I know it, or at least I can contact with them easily. Already we are preparing the next community experience, the well-being health, the emotion health. We are already, it's not, sometimes there are some difficulties because it's important all of them feel we are working with all of them, and needs a lot of months cooperation with nurses and medical practitioners, together with the association. The associations is in our area. The associations are the most important well-being resource we have. The Women Association, the Elder People Association, the Sports Association. So I contact with all of them in the small village, and we start to ask what we decide in a cooperation community meet we have every 2 months. We decide, for example, now the well-being, the emotion, and that's the ¿cómo se dice? Problemas mentales, the mental health. We decide, for example, this system, no? And we start to ask, okay, what do you need for your well-being? What do you need? And we ask to the association, and we try to get and to speak with all the protagonists in the small villages. It's not easy, the participation, but this year have response 200 people. It's okay. It's okay. You know, it's very difficult. The people write down something, or but we are we try during some months, and at the end prepare something, and we try. They feel is they are important for us. For example, for one the small village, we offer some meeting. What do they need? And we offer one. For example, right now in this the next 2 weeks, for example, they ask for us one, ¿cómo se dice? One meeting to relax, or everything. Or maybe now they are asking for some keys to sleep better, for example, no, in these 2 weeks, or the anxiety, you know. So we try to involve all of the small village together. The key is, okay, we are preparing a meal, and we need you. What would you like to prepare? And at the end, they all of them prepare something. Another, for example, one group of women music group. We invite them to make sing something, or no. We try to involve all of our resources. I don't know if I mean. Sorry for my English.
Thank you very much. Yes, for this very perfect description of your work. Thank you.
Yes, we can see you are quite close to the community, no, and you are responding to their needs. So I would like to ask also to Gloria and Melen the same question. How do you work with the municipality in your area?
Thank you for the question. As I explained briefly at the start of the presentation, the way of communicating between municipalities is because we are 3 basic health zones, but we are cohesionated and we are an active region directed some way to say it, by Manco del Sports, which is a network that questionates these 3 basic health zones, because they are also near between they. And once we had the program questionated, communicated, and organized, we made the presentations that Belen said, the reunions, the meetings, and these ones. The first one was in Morella, the second one in Forcai, and the third one in Vilafranca. And then also we received the clinical formation required and external support, and directed by the 2 coordinators per basic health zone that promoted the groups, and also the physicians that work here and Forcai and at Vilafranca. It's nice to observe it because they know each other of quotidian activities at the supermarket, or one a rural hike, and it was there was a really tight relationship previously. I don't know.
Okay.
I think that it was difficult to get the 2 coordinators for each basic health center, and that was an important thing to cohesionate and to work in this project.
Thank you.
Thank you very much.
One second.
Yes, sorry. You wanted to say anything else, Belen? Sorry, I didn't understand. No, it seems not. So I just I saw that Poonam, that you raised your hand. I don't know if you want, if it was my mistake or if you want to, because I don't see it anymore. If you want to,
yeah, I did raise, but I put it down because of the time constraint. I thought there wouldn't be enough time. So, but I'm gonna ask it quickly. I have a question for Miroslava. Thank you so much for introducing us to your organization. I would want to know a little bit more about the nature of funding. Do you only give it for action work, or there's also a scope for doing research? Do you also only give it to NGOs and civil society organizations, or are there possibilities of collaboration between academic partners and civil society groups? Thank you.
Thank you. One second. Please, Belen, Gloria, could you stop sharing the screen? Because we see your screen of the project. Could you please stop? And I will ask you, Miroslava, to please be brief. Thank you.
Yeah, very briefly. It's unrestricted, Poonam. It's unrestricted. When women, organizations, groups, initiatives come to us and ask for support, and it makes sense, and we've got money, we can support them. It's unrestricted in terms of theme.
Perfect. Thanks.
Thank you. Thank you very much, and thank you for being so brief. So yes, we arrived to the end of the event. So now I would like to thank you very much to the speakers of our second panel, to all of you to present very interesting projects. Miroslava, also Gloria and Belen and Begoña, thank you very much for your participation. And I would also like to thank you, all of you, all the attendees and all the participants, for your participation and for being here until the end of the webinar in a very busy period that we know that we have now. And also I would like to thank you to my colleagues, Sophie, Anne and Alex, that have been, of course, or participating in the organizing of the events. So now I would just like to mention the next steps in the SERIGO project. You can follow us on social media, on the website, and subscribe to our newsletter. And for now, we are planning another online event, probably for October 2026, that would be Unlocking Finance for Community-Led Social Innovation. And we will address challenges to access grants, ethical finance, crowdfunded and cooperative funded models. So I hope it's also interesting for some of you. And before we finish, I would like to ask you to please fill in the feedback survey that we have after all the events. It's only 1 minute, it's quite short, and you could let us know your insights, and also if you have any other topic that you would like to address in the events that are coming. As you know, in SERIGO, we still have almost 2 years of events, and we will continue with these online events. So thank you very much, and I think this is all on our side. Thank you.